Hi, everyone. Thank you for joining us for today's webinar, Case Study Template and Guidelines. We will begin shortly. First up are the housekeeping rules. So this session is being recorded and the recording will be available on ISPO Learn. ISPO members can access it directly through the platform. Non-members will receive separate instructions on how to view it. Please, we kindly request you to stay muted throughout the session to avoid background noise. Closed captions are available. Please enable them if needed. We also encourage you to post your questions in the Q&A box at any time during the session, which will be addressed towards the end. We are happy to also share that today's webinar has two live interpretation, both in French and Spanish. And we kindly request you to enable them if you need them. So this option is at the bottom of your Zoom menu options. And if you click on the interpretation arrow that marks up, you'll be able to select either the French or the Spanish. We are also happy to report that this webinar, if you attend this webinar throughout, you will be receiving the certificate of attendance towards the end when you complete a short survey to receive 1 CPD point. The link to the survey will be shared towards the end of this webinar. Today's webinar will be moderated by Dr. Arizo Eshraghi, a certified prosthetist and researcher at West Park Healthcare Center in Toronto, Canada. Dr. Eshraghi holds a PhD in biomedical engineering and completed both her bachelor's and master's degree in prosthetics and orthotics. She's an active member of the ISPO Scientific Committee and played a key role in coordinating and bringing this webinar together. Thank you. We are grateful for her contribution and pleased to have her serve as our moderator today. Over to you, Arizo.
Thank you, Kritika. Thank you, everyone, for your participation and our guest speaker. Dr. Phil Stevens is going to be the speaker for this webinar. Phil Stevens is the Vice President of Clinical Affairs for Hanger. He has a PhD, he's EMD and a CPO. In addition to his graduation from the University of Washington's Prosthetics and Orthotics program and completion of a master's degree in Allied Health Education and Administration from the University of Houston, he earned his PhD in Kinesiology from Concordia St. Paul. He currently holds an adjunct faculty position within the University of Utah's Department of Physical Medicine and Rehabilitation. He was a co-editor on the 4th and 5th edition of the Atlas of Amputations and Limb Deficiencies and has authored more than 20 textbook chapters and more than 70 peer-reviewed publications. He currently sits on the editorial board of the Journal of Prosthetics and Orthotics. Please welcome Phil Stevens.
Thank you. And thank you to the ISPO for giving me this opportunity to share some content with you today. If you'll give me just a moment, I will pull up my deck so that we can have a bit of a conversation. Let's see. There we go. Okay. As per the introduction, our topic today will be case studies. And in particular, I want to walk you through the case study template that's been developed by the ISPO. In doing so, I'll just share with you preemptively that there's a few resources that we're going to make available to you at the conclusion of the webinar. You'll get a copy of my deck in a PDF format so that you'll have my slides and you can look through those as you find them helpful. We're also going to share a copy of the case study template, the PowerPoint document, so that you can build your case study on that template for ease of sharing and posting. And then we're also going to share the link to a YouTube video that's a very practical short video that shows you exactly how you would take a case study and submit it to the e-learning platform for ISPO so that it can be added to their library. So those resources will be coming to you at the conclusion of our conversation today. So what I'm going to do is simply walk you through this template with a few thoughts and ideas along the way that hopefully you'll find helpful as you consider submitting a case study yourself on this platform. The first thing I would say as we contemplate the topic of a case study, remember the purpose. The purpose of a case study is to educate. It's to educate your peers. It's not to brag or to boast about some very complex case that you were able to solve. It's really about teaching. It's about introducing principles that your colleagues can translate to other cases. And so as you're thinking about a topic that you might want to use in a case study, think of cases where you learned something. Maybe you learned something new. Maybe you relearned something that reminded you of something you had learned in the past, or maybe it was a new application of something that you've known for some time. But think of a case that taught you something. If the case taught you something, there's a good chance that it would teach the same principles to your peers. I think sometimes case studies can get misused because the authors try and present on very complex, extreme cases. And to be candid, sometimes those very complex, extreme cases, they may be impressive, but they're difficult to learn from. Remember that the goal of a case study is to teach. And so don't feel like you need to present on some magnificent, complex, difficult case. In many cases, a more basic, a more foundational, a more fundamental case can do a better job of teaching, of training, and of presenting principles that could be applied in other in other applications. Remember that this is a very practical way of providing education. I think a lot of times we want to contribute, and it can feel overwhelming to contribute because if we feel like a contribution requires a randomized controlled study or a peer-reviewed publication, that can be very daunting for many professionals in many scenarios. But again, a lot of what you've learned in your career, you've learned through individual cases. And so when you share those cases with your peers, you can contribute to their knowledge and their education the same way that you might contribute if you were publishing an article or performing a complex clinical trial. So please don't undervalue what a case study can offer to your colleagues and to your peers. It can actually offer quite a bit of education and training. So think of a case where you learned something or you were reminded of some foundational principles. The next step is to provide a title for your case study. The bullet point here says enable decision making, not a mystery, meaning what you want to remember is that your case study will be in a library of many other case studies. And so if you try and come up with a cute or clever title that's a little bit vague, there's a good chance that people won't watch it. People are busy. We're all very busy, and people need to make quick decisions about how they're going to use their time. So make sure that your title is very clear. That will help your audience, your population, make a decision about whether or not this is the case study that they want to watch when they have limited time. So your title should be very clear. What is the population? What was the intervention? What was the impact or the outcome of that intervention? If you put all that in the title, it will help your audience know quickly if this is how they want to invest their time. The other thing that this does is it facilitates what we might refer to as just-in-time education, meaning your learners may be in a situation where they're going to see a novel patient population that they're not familiar with. If you've clearly defined that population in your title, then your learner can see that, quickly appreciate that, watch your case study, and be prepared for that case that they're going to see in the near future. Just-in-time education can be really valuable and can be a real asset to busy clinicians. So again, that definition and that clarity can be extremely helpful. The other thing is, please don't feel like a case study needs to be extremely long. Again, most of the people in your audience are busy. Their time is short. And so if you can present a powerful case study, a comprehensive case study in 15 or 20 minutes, they will appreciate the brevity. One of my mentors in the field characterized it this way. He said, the goal is to be brilliant, be brief, and be done. So don't feel like you need to consume a tremendous amount of time on a case study. Once you've canvassed the material comprehensively, then you can wrap it up and be done. The next element of the case study is the introduction. This is where you list the author's name, the institution, the city, the country, the contact information. The primary reason for this is that it provides context for the case. If your audience understands whether you're in a public or a private institution, a larger or a smaller institution, whether you're specialized in your care or you're more of a generalist in your practice, it helps them understand where you're coming from. It helps them understand some of the resources that you might have. It might help them identify with you a little bit more as a presenter if your situation is somewhat similar to their situation. So these little details can convey a lot to your audience about the environment that you're practicing in. And then the contact information is helpful because a lot of times if someone wants to pursue a track similar to the case you've described, they may follow up with you with additional questions. There may be some additional detail that would be helpful to them. So the contact information will facilitate those ongoing conversations. The next slide that you'll see in the template is a disclaimer slide. If you've never worked on one of these before, this is where you can disclose any conflicts of interest. Most of the time when we speak of a conflict of interest, it's a financial interest in a technology that you're presenting on. Now that happens, and that's okay. If you have a financial interest in a technology, that's a reasonable thing that happens often in healthcare, but you have to disclose it. That's what the disclaimer means. That you as my audience should appreciate that I have a financial interest in this. I'm going to tell you about the outcomes. I'm going to tell you about the results. But as you hear this, you need to understand my position and where I'm coming from. This disclaimer just provides context for your remarks. Again, these relationships are reasonable to have, provided that you disclose these relationships so that your audience understands your position. This is also where we want to report that we obtained consent from any patients that we'll be talking about in the case study. So if it's a prospective study, you certainly want to address this concept of informed consent. The patient knows what I'm sharing with you today. The patient has given me permission to share the details of the case I'm going to share with you today. In many cases, we're protecting patients by de-identifying them. So this is where you can also disclose that all patients today have been de-identified. Maybe you're changing their name. But this is where we protect the patients, and we make clear to the audience that we've been thoughtful about protecting the patient's identity and respecting their privacy before we shared this case with a wider audience. The next section in a case study is the abstract, and as you can see here, it's the first recommendation that they put on the slide. The abstract is typically the last thing that you write, because the abstract is going to be a summary statement. This is where you'll summarize the problem, the method, the results, the discussion, and it's pretty hard to summarize these things before you've written them. So typically what you'll do as you're actually putting your case study together is you'll write out the longer slide, the longer narrative on each of these elements, and then you'll come back and you'll make a synopsis or an abstract, a summary of each of these elements. Again, the value to the abstract is the recognition that everyone is busy and they need to make a quick decision about whether or not this is a good use of their time. So the abstract provides a quick overview of what the rest of the case study is going to contain, and can be very helpful in making those types of decisions. So the first element of the actual case study is to provide an introduction and some background information. By providing this introduction, you're kind of helping you're letting your audience know what population you'll be treating. That helps them understand if this is a population that they can relate to, if this is a population that they treat, and you want to let your audience know what they'll gain from the case study. In addition, you want to provide some citations. It doesn't need to be overwhelming, but you want 2 or 3 citations in your introduction that that helps your audience understand that you have looked into this problem. You've looked at the literature. You know what the literature said. You're aware of the science in this area. That's what the citations convey. It conveys that you've done your homework, that you're prepared to speak in this space. So it basically says, I've studied this problem before I've come to you with a proposed solution. The other thing that I always do, whether I'm presenting a free paper at a podium, similar to what we're doing today, or whether I'm writing a paper for publication, is there's always a very clear statement that says the purpose of this publication or the purpose of this case study is, again, be abundantly clear. That we're not out to introduce a mystery that we'll solve at the end of the presentation. We want to be very clear from the outset. This is what I intend to show you today. So that purpose statement should be part of your introduction. The next thing you want to do is speak to the methods of your case study. So talk about introduce the patient or the patient population. You want to certainly de-identify individual patients, but we can facilitate translation by a good description of the patients involved. When your audience understands the diagnosis, the presentation, perhaps the age of the subjects, that helps them translate your work into their work. They understand whether or not your patients match their patients. So the more you can provide that description, the easier it is for your audience to translate what you've observed into their own practice. Articulate the problem and the challenge, and make sure that you do so I'll say in both ways, right? So the problem and the challenge, oftentimes in our world, that can be a biomechanical problem, a biomechanical challenge, something that you've noticed in gait. And you might speak of joint angles or joint moments, joint forces. That's part of the problem. That's part of the challenge. But please appreciate that the other part of the problem, the other part of the challenge is the patient experience. What is the patient conveying to you? It's really important. We've got translators on our webinar today because people speak different languages, and it's important for us as presenters to be bilingual. We need to speak the language of biomechanics and understand what the biomechanical needs of a patient are. But we also need to speak the language of our individual patients and understand their concerns and understand their priorities. So as you introduce a case study, speak to both of these elements, the biomechanical concerns, as well as the human concerns and the patient perspective. You can then share your procedures and methods, exactly what it is that was done as part of that case. And please consider images and video. A case study that's just narrative may not be very engaging to the audience. So a picture is worth 1,000 words. So if your audience can see a still picture of the patient, better yet, if they can see some active video of the patient, they can more readily appreciate any challenges that they might be experiencing relative to biomechanics and gait. Tables and charts can also be very helpful, as they can convey a large amount of information fairly quickly, and it's easier for your audience to understand and internalize the observations that you've had. Go to our next slide. You're going, after you've presented your methodology, you'll present your results. And what sometimes happens here is you can slip into presenting your results and your interpretation of the results at the same time. That's not the ideal. The ideal is that you present your results very objectively at first. So you'll have a slide or two that just reports what you saw, what you measured. And then in subsequent slides, you'll be given the opportunity to interpret what you saw and perhaps try and explain some of what you saw. So this is very objective only. The subjective part will follow. What did you see? What did they experience? Again, you want to represent both voices. What did you see? What were the biomechanical elements that you observed in their gait, in their standing, in their transfers? But then what was their lived experience? This is another opportunity to relay the patient voice and to make sure that clinically we're addressing both biomechanical considerations as well as the patient experience. The goal here is to facilitate translation. So you're giving your observations so that folks can emulate what you've done and have a similar experience with their patient or in their environment. Again, you want to be brief, you want to be concise. Another risk here is to share too much. Again, at the very beginning, you said, my purpose is to, and so you had a purpose statement. There were some specific things that you wanted to look at as part of the case study, or some specific things that you wanted to teach or convey as part of the case study. Stay close to those key points. What can happen here is that you share too much. And if you're sharing elements that don't relate to that key point, those can distract from your message. Those can dilute your message. So avoid the diversions and stay close to your purpose statement. From the very beginning, you've kind of defined, this is what I want to, these are the principles I want to teach with this case study. Stay close to those principles and avoid distractions that could pull away from your core message. Once you've shared all of your objective observations, we move into the discussion. This is where we move from the objective observations to the subjective interpretation of what you saw. So this is where you can share some of the clinical insights that you gained. What were some of the good things that you observed? What were some of the concerning things? There are some very good case studies that talk about what went wrong and what I would do differently next time. So you don't always have to win. Sometimes we can learn a lot from a case where we didn't make the best decisions, and we have some ideas of what we would do next time. So share both. Share the good things and the concerning things. This is where you can start to share possible explanations. So try and offer some potential explanations for what you observed. But remember, this is a case study, and the nature of a case study is that there are many, many variables as far as the presentation, the diagnosis, the age, the available funding, the family situation, the psychosocial support. And so it's difficult to say that the outcomes we saw in this case can be attributed to this specific factor. There's a lot of different factors involved. So we need to be careful that we don't overstate, that we don't assume that that what we saw today was the specific result of this factor, because there's many factors at play. But this is where you can explore possible factors and then allow your audience to think through their interpretation of the data. That's why we do it the way we do it. When you share your objective findings first, that allows your audience to infer and think through what may have caused that result. Then you're going to share your interpretation, but they may also have their interpretation, and that's entirely fair and reasonable. A lot of times with a case study, you'll answer some questions, but not all the questions. And so it's very fair to say, here are some additional things that I can't fully explain. And you want to speak to the limitations. And the first limitation of a case study is that it was a case study. We saw this in this individual. You may or may not see it in yours or in a similar individual because it is a case study with multiple confounding variables that need to be considered. And so after you've interpreted your results, this is where you offer your conclusions. And you always want to go back to your purpose statement. Again, at the very beginning, you've defined the principles that you intend to speak to with this case study. Come back to that at your conclusion so that you have that consistency throughout the presentation. Did you accomplish your purpose? Another trap here is you should never introduce anything new in your conclusions. And sometimes that happens. If it's in your conclusion, it needs to be something that you've talked about in your introduction, something that you've talked about in your results, something you've talked about in your interpretation of those results. So please don't introduce new bits of information in the conclusion. The conclusion is just summarizing everything that you've spoken to thus far in your efforts. And you want to highlight the significance and the application. Again, case studies are performed to teach. So what was it that you were trying to teach? How can your audience apply what you've done to a similar case in their own clinical portfolio? What are the principles that translate well or that might translate into clinical care? What can they take away with them and apply in their practice? The acknowledgement slide is very important. Most cases are you've had some help. They're rarely completed in isolation. So this is a chance for you to acknowledge the people that contributed to the study, whether that's a colleague that worked with you on the case or a mentor that provided some guidance along the way. In a case study, it's very kind and appropriate to acknowledge the patient and the family members of that patient that have allowed you to share their case to a larger audience. If you've had any financial support on the case, it's good to acknowledge those funding those funding sources or any sources of financial support. Then at the end, you'll have your references. I mentioned at the very beginning that it's very appropriate to have a few citations to indicate that you've studied this content and that you've looked at the science in this area. Those citations should be referenced. They'd like the request from the ISPO is that you use the referencing paradigm that Prosthetics and Orthotics International uses, which is the Vancouver reference style. The world's gotten a little bit easier. You can use the internet to ensure that you're utilizing the Vancouver style of referencing. But I've given you an example of the Vancouver style for a journal article and for a book, so that you have those as a reference when you go to put your own citations in. And then the last element is your thank you slide. You always want to conclude with gratitude. People have taken time out of their day to enjoy your material, and you want to thank them for the time that they took to enjoy your presentation. So we always want to say thank you. And with that, this concludes my formal presentation. So I will thank each of you for your time this morning. I'll turn it back over to our moderator to facilitate any discussion or question and answer. Thanks, everyone.
Thank you, Phil. Dr. Stevens, it was great. I enjoyed. I hope everyone else also had the same feeling because it was so clear, and it was for every clinician or a scholar at early stages of their practice or even more advanced. Thank you for that. As Kritika mentioned in the chats, please, if you have any questions, the participants, please put it in the Q&A part of the webinar. Meanwhile, I personally would like to ask you, since you are on the editorial board of the Journal of JPO, Prosthetics and Orthotics, I would like you to share with us your experience in terms of when you receive a case study for publication in the journal, how do you treat that? And then what are some of the points that may be interesting for those who want to submit to the journal?
Yeah, very good. Thank you for that. One of my first publications early in my career was a case study in the JPO. That was one of my first attempts to publish. What we are looking for is objective findings. And the challenge is we don't always collect objective findings in the course of clinical care. We see a problem, we address the problem, and we say, wow, I did a good job. I can see that I did a good job. Well, readers can't see that you did a good job unless you have objective findings associated with that good job. So I think one of the challenges to us is to do a better job of utilizing some form of outcome measure in our day-to-day clinical practice, whether that's a performance measure or a patient-reported outcome measure, but something that documents their baseline condition and that documents their follow-up condition so that you can quantify the impact that you've had on that individual. Some measurement of the before and after. Pictures are helpful, certainly, but pictures aren't enough in isolation. You really need to have some objective assessment of the impact you've had. So I would say that would be the first thing to think about as far as publishing a case study is what do you have? What quantifiable impact have you had? You'll need to share that as part of what you submit.
Thank you so much. I think it was very helpful. I learned a lot. We have a question from the audience. Lucky Mabaka is asking, when would you advise a CPO to start writing these case studies?
What a great question. I think it can happen in one of two ways. I think I've had instances where I was going to take care of a case, and as I started that case, I knew that this would be something unique and that I should be preparing along the way. And so I was very thoughtful in documenting everything with that case throughout the journey. I've had other times where it wasn't until the case was completed that I reflected on the case and thought about the things that I learned from that case. So I think the challenge or the invitation probably is to manage all of our cases as though they could become case studies. And what that means is we do a good job of documenting all of our cases. So go back to the presentation, clearly document that physical presentation so that you understand your target audience. Clearly document what it is that you did, your methodology. What did you do for that patient? Integrate some type of outcome assessment into your clinical care so that you have a quantifiable impact with every patient that you see. If you do those things, then the last part of interpretation, well, you can do that a little bit later, provided you've done the other things on the front end. So I have certainly had cases where I thought, boy, this is going to be a powerful case study. And when I finished, not so much. I've had other cases that I didn't anticipate becoming a meaningful case study, but when I reflected on the results, there was some really good information there. So I think the invitation, again, is to treat every case in a manner that you could later create a case study with the necessary details.
Thank you. That was a great advice. I think it's important that basically, I guess I would say the earlier the better. And then, as you mentioned, if we treat every single case as a case that might be interesting, or it could be. My other question is about the case series. It might be interesting for the audience to know, like, when do we call it a case series? Rather a case study, that it could be confusing to some people.
Yeah, in my experience, as soon as it's more than one patient, I would reference that as a case series. It could be a very short case series of 2 subjects, but I've seen case series that only contemplated 2 or 3 patients, and then I've seen case series that included 7 or 8 patients. But I think for me, a case series is just more than one subject with related attributes that have some commonality between them.
Great. Oh, we have more questions from the audience. Sorry.
Yeah.
Andre is asking, good day, Mr. Phil Stevens. Thank you for sharing your methods. I would like to clarify if you usually also request for approval from the clinic head or an ethics committee before writing a case study about a patient you've had.
Okay, really good question. Um, so in my okay, let's see. Ethics are complex, and ethics are governed by different considerations depending on where you practice, what country you live in. Um, in many cases, for example, an institutional review board would be required if you were doing something prospectively. In most case studies, we're not doing something prospectively. The nature of most case studies is a retrospective analysis of what happened. So, but we need to make sure that we clearly distinguish between those two. If you are experimenting on someone, if you're going to try something new just to see what happens, well, that requires a deeper investment in the ethics component. If you're going to, if they're in brace A and you're going to put them in brace B because you're just curious to see what will happen, that's an experiment. That requires ethics, that ethical review. That requires an institutional review board. And so that's one scenario that you might find yourself in. In many instances, a case study is you're taking care of a case. You're providing the standard of care. A patient comes to you, you assess them, you intervene, you document the outcome. If you're looking at that retrospectively, that's a different level of ethics consideration because you weren't experimenting. You were managing patients the way you normally do, and you just documented the impact along the way. So I think it depends on whether you're prospectively experimenting on someone, in which case you must involve an ethics committee, or if you're reviewing a case that you managed as part of your standard practices.
Thank you so much. Kurt is saying that great presentation, Phil. In addition to what you have already brought forward, are there any common mistakes or things that are forgotten while preparing for a case study?
Yeah, I mean, there's a lot of things we can overlook and forget. I think no, I think if you stay fairly close to the principles that we talked about today, you'll be in pretty good shape.
Thank you. Conbus is asking, besides Vancouver type of reference, is it advisable to use maybe Harvard or APA? I guess that one, it depends on the journal or the conference that you are presenting your results to.
Yeah, yeah. What I would say is that so what we've shared today is very specific to the ISPO. This is the template that they'd like you to use, and so I stayed very close to that template. As part of that template, they've requested that for the ISPO submissions, they want it to align with POI, Prosthetics Orthotics International, and for them, that is the Vancouver style. But to your point, it's one of the fun challenges of writing journal articles is that the first thing you need to do is go to the publisher and find out what their preferences are, and going back to the initial question, you do have to be mindful of that because different publishers will often request different referencing styles, and you need to honor those.
Great, thank you. That was a complete answer. Um, uh, we have a lot of questions about the ethics, which I think you covered most of them. And then another question asking, would you please mention the ideal word limit for case study? I guess
Yeah.
again, it depends on
Again,
the.
it depends on the application. So if you're submitting it to the ISPO e-learning platform, you would want to stay very close to the template that we're going to share with you at the conclusion of the webinar. Most journals have a word count limit for case studies. And so I know POI has a strict word count limit for a case study. So you want to, I don't remember what it is off the top of my head. It might be 1,500 words, but
Yeah,
check me
usually
on that.
50.
Yeah. So check with the journal and find out what their expectations are and then honor those expectations.
And I guess a lot of thank yous, and thank you so much for your participation and our audience today. And um, uh, I personally have another question. I wonder, because sometimes as a clinician, I feel like, okay, maybe my case study is not a very interesting one, or maybe I should see like, I don't know, a case that no one else has ever dealt with, but it might be hard for you to figure out. I mean, you can do a literature search and figure out if no one else has dealt with this case, but at the same time, you may think it's interesting. So how do you usually, as a scholar and clinician, you treat that
Yeah,
dilemma?
I know it's a good question. I think it depends a little bit on your audience. But for the ISPO e-learning platform, I think it's important to recognize that our audience is very diverse. Our audience comes from all over the world with different levels of education, different levels of resource, very different environments. And so a case that might be very easy for you might be quite instructive for someone in another part of the world. So I think what I would go back to is, did I learn something? If I learned something, then someone else might learn from that. And so that I would use that as my guiding light. Now, as if we start talking about publishing a case study in a peer-reviewed journal, then you have to do a little bit more homework. You need to understand if if uh, if if there's nothing novel in that case study relative to what's already been reported in the literature, then it's probably not, it's probably less likely to get published. But as far as the ISPO e-learning site, I would just go back to this recognition of the diversity of your audience. If you learn something from the case, there's a good chance that someone else in the audience will learn from the same case.
Yeah, so basically, we shouldn't, because we may have clinicians who are just fresh graduates or just started their practice, and they may think that, okay, this might not be interesting to anyone, so just let's disregard it, or they don't have that confidence of actually sharing what they are excellent at with the rest of the professionals around the world.
Yeah, but
Um,
remember,
yeah.
I think it comes back to the title. If you provide a very clear title that clearly defines the target population and the intervention and the results, then your audience can make that decision, right? So you don't have to decide, was this interesting enough?
On their
Your audience
behalf.
will
True.
decide. Yeah, yeah, it's their decision, right? Not yours. So
True.
I think, and the other thing is, if you've never done a case study, do one. Pick a case that you learned from and do one, because you will learn. And the process of putting that case together in a case study will require you to reflect upon that case and the things you learned and why you learned, what you saw, and what may have caused it. Anytime you package material for a publication or a presentation, you will learn in the process of putting that material together. So if it's not something you've done before, I would encourage you to reflect on a recent case that taught you something and give it a try.
Great. Yeah, I guess they can also start with presenting to their colleagues. Like so many of us, we are working in a hospital, even if it's a small clinic, we still have like colleagues that might be interested. So it will give us the confidence, and then we will get the feedback, and then we will improve as we go through that. Thank you. Um, so Kamaraj is thanking again for your great presentation. And Husa actually is bringing up an interesting point. Can we publish a case study on a case which was not a success story, even after trying everything the patient didn't recover fully?
Well, I, the question for me would be, will someone learn from this material? Okay. So if your case study is just lamenting that nothing worked, there's nothing to translate into future cases. If we've learned that this population does not respond to this intervention, you might be able to translate that into clinical practice. So I think the question is, can this material be translated into clinical care? If there are principles that can be translated, then I think it's a worthwhile endeavor. If it's just sort of regret that nothing worked, that's not instructive. So.
Great. Yeah, great answer. Thank you. I just want to share my personal experience because we in our hospital, in terms of the ethics, we have started actually collecting the consent from every patient that is admitted to the amputee unit. So that in case in future we want to use actually their information or some of the outcome measures that we take while they are in the hospital or while as an outpatient they continue their care, then we have that consent. How do you see that? Is it gonna help if in other the other audience in their workplace they are not doing that? Do you think it's a good practice that they get that consent from every patient that is admitted so that in future they have more flexibility and less paperwork or regrets and saying that, oh, I wish I had the consent so I could
Yeah.
publish?
I'll share that within Hanger, we do have a blanket IRB, Institutional Review Board ruling, that allows us to do a retrospective analysis on the outcomes that we collect. So we've done that on our side to create that opportunity. I think there's a great action item here actually for the ISPO. I think what you've done makes tremendous sense. I also appreciate that for many of our clinicians scattered around the world, they may not have that document, they may not have that language. I think there'd be tremendous value in the ISPO creating a consent template that our members around the world could access and utilize in their clinics, so that they can address this very, very important consideration of making sure that the patient is given the opportunity to influence how their care is discussed after they receive it.
Great point. Thank you so much. I guess I can bring it, or Kritika can bring it to the rest of the team, and we actually come up with that template. We will actually, we may learn from what you did at Hanger as well. We may reach out if you don't mind. Thank you. I guess we don't have any other questions or comments from the audience. I'm gonna thank you again for your providing this opportunity for our audience at ISPO, and we would love to get the feedback from our audience after, and I'm pretty sure it's going to be fabulous. And if in future we find something, we would actually appreciate if you would be willing to share again with our audience. Appreciate your time. Thank you so much. And I will pass to Kritika for last remarks. Thank you.
Thank you, Rizo. Thank you, Phil, for the wonderful presentation. We really enjoyed it. Thank you so much for your time. I just wanted to quickly share the QR code for this survey. I'll stop here for a few seconds. If you could please scan the QR code to complete a short survey. And once you complete them, you will automatically receive your certificate of attendance from this webinar in your email. And don't worry if you missed it. We will also be sharing a few other materials Phil had mentioned earlier, and the link to the survey in just a few minutes after this webinar. And if you've already not registered, please do register for our upcoming webinar on July 8th at 16 CEST. This is the Diabetic Foot Medical Management, Screening, Early Diagnosis, and Principle of Treatment. The QR code is right on your screen. We're also doing promotions through our newsletters and social media. So Thank you again for your time. I wish everybody has a wonderful day. Thank you so much.